Yeah. Good morning, afternoon, everyone, and welcome to the American Heart Association's Data Submission 101 for 2025 Outpatient Award Achievement. We have quite a lot of ground to cover today, so we'll go ahead and get started while everyone is hopping on. So as a reminder, this meeting is being recorded and slides will be available to all registrants after our call today. Please type all questions into the Q&A feature for the bottom. The button for that is found at the bottom of the toolbar there, as well as the chat for messages from the AHA and AMA teams. If you have questions after we log off or will be requiring a password reset or need a new user account, you can do so through the links found on this slide. Some general housekeeping and accessibility. You can view or hide the transcript in the subtitle option setting under live transcript and adjust the font sizes as needed. All right, and again, we'd like to thank you very much for joining us today for our Data Submission 101 webinar hosted by the American Heart Association's Outpace CVD team. Outpace CVD is the AHA suite of outpatient partnered initiatives and programs that include Target BP, Track Change Control Cholesterol, and Target Type 2 Diabetes, and aims to provide QI support and recognize your commitment to improving outcomes of cardiovascular disease. This webinar will be specifically focused on the data submission process for Target BP, Track Change Control Cholesterol, and Target Type 2 Diabetes. So I'm going to kick us off today by introducing today's speakers and quickly run through our agenda. That looks nice and light, but I promise you there's a lot of info packed in here. So my name is Rebecca Olecki. I'm a senior program consultant for outpatient quality at the AHA. I'm joined by my amazing colleagues, Liz Montgomery, program consultant for outpatient quality at the AHA, and Allison Smith, initiative director for Target BP with both the AHA and the AMA. Today, we'll start off by going through the award achievement timeline, eligibility requirements, and some updates, followed by data submission details and criteria. And then Liz will jump into a quick platform demo, and we will land on resources and tips for the data submission process. So let's start with a brief overview of what last year looked like in terms of our achievement awards in celebration for all of the amazing healthcare organizations we've had the pleasure to work with. In 2024, nearly 1,900 organizations submitted data for Target BP, Track Change Control Cholesterol, and Target Type 2 Diabetes. As you can see, these covered tens of millions of patients across the United States, including some territories as well. Such a large percentage of those submitting data achieved Gold or Gold Plus award status. So congratulations to all and really amazing work. So we will move now to a quick poll to let us know our audience a little bit. We would love to know, is your healthcare organization a first-time data submitter this year, a repeat submitter, or are you unsure? Got some responses coming in here. We'll give this just another couple of seconds. Alrighty. And the poll here. So it looks like a good majority are repeat submitters, but we do have a lot of first-time data submitters. So I'm really excited to see those first timers and welcome back to those that are repeating. And I think, let's see, we'll stop sharing that. And at this point, I will pass it off to the lovely Liz Montgomery to get a little bit more into the details.
Thanks so much, Rebecca. And we have a lot of details to get into, starting with our timeline. Right now, you can submit, edit, and revise your 2024 data in our online data platform. The deadline for data entry is Friday, May 16th at 11:59 p.m. Eastern Time. And please note that the time zone is Eastern Time because it's not going to be 11:59 p.m. everywhere. Data will be captured at exactly midnight, 1 minute after the deadline, to determine award status for all sites. So if you take one note during this call, please note that deadline. Next, the AHA and AMA will be reviewing and validating the data submitted to classify awardees by award level. You might hear from us during that time frame, mostly in June, if we have any questions about your submission, and your response will be really vital to help us confirm your appropriate award level. During the fall, we will then notify 2025 awardees with your congratulations email and toolkit and celebrate your accomplishments on our program websites. The recognition doesn't end there. We'll follow those with additional highlights of awardees at scientific sessions and in certain local or regional events. Throughout the presentation, we'll be emphasizing our suggestion to submit your data early, and being on this call is a really great start for that. The reason for this is that we want to make sure that we can provide you with the best support available when troubleshooting any errors. This might be a confusing question you need support answering, or it might be a technical issue uploading your data. As you can see here, we tend to get the vast majority of our data submissions in the final month. And our team is supporting over 15% of all data submissions on the final day. So our team's going to do the best that we can to help you get your data in on time, no matter when it is. But if you do submit earlier, we'll be able to be a little bit more hands-on because we'll just have greater capacity to do so. Moving along, let's talk quickly about the benefits of receiving an achievement award. Like I mentioned earlier, we're going to be providing a national award listing on our website, which you can see 2024 award winners now. Really invite you to go take a look. We also send a national press release, acknowledge award winners at the prestigious scientific sessions, and provide different regional opportunities to share successes. For your own promotions, we'll provide an award certificate, a digital awards icons, and a very comprehensive toolkit that will help your marketing teams send a press release, social media messaging, email signatures, etc., etc. There's several more items in that toolkit. As we dig in, we'll start by sharing what kind of organization is eligible for these awards and award benefits. We have a broad range of organizations that participate, but the fundamental criteria is that your healthcare organization, as registered and as submitting data, must directly diagnose and manage patients with these chronic disease conditions. This means that your organization must be prescribing and managing the medications of these patients. It also means that if you are primarily a screen and refer organization, you would not be eligible for an award. Our quality improvement tools and resources, though, they're going to remain freely available to all. Screen and refer, direct patient management. We encourage you to share those broadly. There are 2 steps to submit data for an award. The first step is going to be to register. So this is for our new participants in the poll. This enables us to create a profile and user login for you in the online data platform. If your organization is new to submitting data, you can go to heart.org/registermyoutpatient.org to do that registration. If you have submitted data before and you already have a profile, so our repeat submitters, you do not need to re-register. You can skip straight to entering data, which we'll cover next. On our registration form, we're going to ask you some basic demographic questions and, importantly, what initiatives you wish to register for. You can register for all 3 simultaneously, so target BP, check change control cholesterol, and target type 2 diabetes. And if you're considering participating in any or multiple of the 3, I really encourage you to select all of them. If you do decide down the road that you'd like to add an additional program or initiative, you will need to return and complete the form again. So starting with all 3 will just save you a little bit of time. And I'll also note that 1 registration equates to 1 potential award. If you want your health system and each of its individual locations to all be listed individually, and also for them each to receive a certificate, you'll need to submit registration forms for each. If you want to register 5 or more sites, there is a multi-site submission process in that same registration link that will save you a little bit of time. The second step is to submit data, starting by logging into our data platform. You'll navigate to Program Forms, hit Add New, enter 2024, and this is because you're entering data from the calendar year of 2024. You'll fill in all the fields, check the Data Entry Complete checkbox, and then save and exit. And then you'll be able to go back in, return to revise your data, really up until that May 16th deadline. But don't worry, I ran through all of that really quick. We'll go into more detail on all of those steps in step 2 a little later in the call. Some of the data that we ask for will be identical across the different program forms and can be copied and pasted from one form to the other. So target BP, check change control cholesterol, and target type 2 diabetes will all be asking you for your total adult patient population, which is question 3 on all of the forms. We'll also ask for a breakdown of that total population by race and ethnicity. And this table is based on a simplified version of Table 3B from the HRSA Uniform Data System reporting requirements for 2024 health center data. But I'll note that we ask you to narrow it down to the adult patients from question 3. So it's not identical, it's just based on that table. We'll also ask for a breakdown of the same total adult patient population by the patient's primary payer and your total number of providers, clinicians, physician's assistants, anyone who falls into that category. This year, all of the forms include a few new follow-up questions that are contingent on your answers to the measure criteria. So the first will be prompted only if your denominator is 10 or fewer patients. We'll ask for additional context on why you have so few patients meeting that denominator criteria, and if applicable, why your overall patient population will be small. The second question is only prompted in target BP and check change control cholesterol. If your performance on the measure is over 90%, we'll just ask that you verify your data, and if accurate, if you can provide some details that might be contributing to your very high performance. If you see either of these questions in the platform, you must fully answer them to be eligible for an award, but they will only you'll only see them if you meet those specific criteria. We've also added a new quality improvement question on each program form. Through these questions, we are really aiming to learn more about how healthcare organizations are working to improve the quality of their healthcare delivery. These are required to be completed as they're going to help us develop our quality improvement materials and design relevant programs that help to meet your needs. This question is on each form, but is tailored to that particular chronic disease risk factor. And to get further into the initiative specific details, I'm going to pass it to Allison.
Thank you so much, Liz. It's a pleasure to be with you all today. Again, I'm Allison Smith on behalf of the American Heart Association and the American Medical Association to talk a little bit more specifically about Target BP, one of the partnered initiatives that today's event addresses. So with Target BP, I'll start with the award levels, the prize at the end of this journey. If we start at the bottom of the page with the foundational participant level, that remains the same as it has in years past, recognizing organizations who commit to improving blood pressure control and complete the data submission process. Again, the silver award is the same also, organizations who complete their data submission and also attest to at least 4 out of the 6 of the measure accurately or M activities. The Silver Plus is the new award that we had announced earlier this year, which will acknowledge organizations who attest to 4 out of 6 of the measure accurately, act rapidly, and one other pillar of evidence-based activities, which I'll talk about in a minute. So a new award level with a slightly higher bar. The gold level is the same for organizations achieving 70% or higher in their control rates. And then the gold plus level is the same, but the criteria is slightly different. And that includes organizations with, again, a high control rate of 70% or higher, and who also attest to at least 4 out of 6 of the evidence-based activities for the measure accurately pillar, the act rapidly pillar, and one other pillar. On the next slide, there's a visual representation of this that I think is easier for me to get my head around. So it would be for the Silver Plus and the Gold Plus award, it would be completing 4 out of 6 of those first 2 columns. And these are shorthand descriptions of those attestation questions, and then accomplishing at least 4 out of 6 of one other pillar that's illustrated on the right-hand side of the slide. So hopefully there are much more details that Liz will share that are available now on some new web pages to dig into these questions more specifically. I do want to highlight the data submission requirements for Target BP, starting with the central metric, the MIPS 236 controlling high blood pressure measure, emphasizing the denominator of adults aged 18 to 85 who had a visit during 2024 and a diagnosis of essential hypertension starting before or coming into the first 6 months of the year. I do want to highlight, as is highlighted on the slide here, that there are exclusions from that denominator, including pregnant persons, persons in hospice, palliative care. I would read those exclusions to ensure that you're providing apples to apples data in comparison to your peer group. The numerator is those patients who have a diagnosis whose blood pressure is controlled to less than 140 over less than 90 as defined by the performance measure. I do want to highlight in the center of the slide here some of the nuances to thinking about who belongs in this measure. So for example, I'll just walk through an example for a patient who had a visit in March of 2024 and was diagnosed in March of 2024. That patient would absolutely belong in the denominator, and depending on their level of blood pressure control, they would be included in the numerator. Another example is for patients who a patient was diagnosed in October of 2024 and had a visit in October 24, they would not be included in the measure because they were too late in the measurement period for that year. I'll leave the other example for your review. And then the rest of the data submission requirements are to answer yes, no, or unsure to the attestation questions, which now have been expanded from the 6 initially and measure accurately across all 5 pillars. So there are 30 questions, yes, no, or unsure. And in order to qualify for the awards associated with them, you would have to have a yes answer to those, and unsure does not sort of count toward those attestations. And then as Liz mentioned, there's a new question at the end that asks you about your quality improvement activities that you may have been pursuing internally or externally, alone or with partners, that helps give us insight into how our support services and resources might continue to evolve to support you. On the next slide, I just want to underscore some minor tweaks that we made to the partnering with patients pillar attestation questions that relate to obesity. And these do not make a material change to the requirements for attesting to those. They just add clarity in the language that more closely aligns with the science, as well as is very much more inclusive language in terms of the topic of obesity. So I just, in case that threw you off, if you studied those before, we just wanted to call those to your attention. So with that, I will turn it to Rebecca to talk a bit more about check, change, control cholesterol.
Thank you, Allison. Yes, so moving to check, change, control cholesterol, there are no changes in award level here. So as always, we recognize organizations that submit data and commit to improving ASCVD risk assessments with a participant award. And then gold awardees meet that specified criteria and also meet the 70% or greater threshold in the statin therapy measure. So looking at the statin therapy measure, MIPS number 438, there has been a slight change in the denominator criteria, which I will review in just a minute. But the measure, of course, overall looks at of patients that fall into those 4 risk group criteria, how many of these patients have been prescribed a statin for their cholesterol. I do want to also note that we have added new attestation questions around the PREVENT calculator, as well as one to further understand your quality improvement activities, which Liz touched on a little bit before. So the changes to the risk group criteria include an adjustment of age in the second denominator criteria to patients aged 20 to 75 years. And then the addition of a 4th risk group that includes patients from 40 to 75 years of age with a 10-year ASCVD risk score of greater or equal to 20%. So next, I'd like to move into the attestation questions for the Check Change Control Cholesterol program. So in addition to measure submission, the program asks submitters if your organization calculates the ASCVD risk score using the pooled cohort equation, how you document the ASCVD risk score in your practice, and if your organization operationalizes a specific treatment plan for high-risk patients, or for very high-risk patients, sorry. This year, we will be asking a new question that will be the same in both cholesterol and our target type 2 diabetes program that asks what your organization's familiarity and use of the prevent risk calculator is. So for those that might not be as familiar, in late 2023, the AHA launched a new tool for predicting a person's long-term risk of ASCVD. So the predicting risk of cardiovascular disease events, or PREVENT calculator, helps clinicians to implement risk assessment for CVD to optimize prevention, facilitate discussion, using the output for risk in both ASCVD and heart failure. So this tool looks at risk factors like kidney disease and metabolic disease, obesity, diabetes, and then additional social metrics such as the social deprivation index. Can't find my words today. I do want to note again that this question will be available in both Check Change Control Cholesterol as question 11, and as well as target type 2 diabetes as question 9. But essentially the question asks to please describe the level of familiarity of the PREVENT calculator, and then where, if at all, the results are documented. So moving on to our target type 2 diabetes program, there are also no changes here to our award criteria and levels. So organizations are awarded as a participant if they submit data and commit to improving strategies for addressing CVD risk for patients with type 2 diabetes. And then gold status recognizes organizations that fulfill the participant criteria and the measure thresholds of A1C poor control less than or equal to 25%. And remember, this is an inverse measure, so the lower your percentage, the better your control rate. And as part of this program, you are also required to submit numerator-denominator criteria for either MIPS 438, which is that statin therapy measure, or MIPS 236, which is the controlling high blood pressure measure. So a gold status recognizes if you meet the HbA1c poor control criteria and meet award thresholds of greater or equal to 70% for statin therapy, or greater or equal to 70% for blood pressure control. So similarly to the award criteria, there are no major changes to the data submission questions. I just ran through measure submission. So organizations will be asked clinical practice questions on standard protocols and treatment plans, which includes that new PREVENT calculator question we just touched on, questions on guideline-based pharmacologic therapy, kidney health, and then a new question regarding your quality improvement activities. So I do want to briefly point out that in addition to the PREVENT calculator mentioned above, there is also a new option in question 8 when asking about operationalizing treatment plans. The PREVENT score is now included as an option to include in your standard process as well. And finally, as I briefly mentioned a moment ago, the requirements for data submission in target type 2 diabetes are such that you must also submit measure data for MIPS 438, which is the identical measure that we use in change control cholesterol, or MIPS 236, which again is also identical to the measure in target BP. So you can choose option 1 or option 2, but it is required for an award to submit at least one of those options. So before I hand you back to Liz, I'll cover just a few key takeaways here. So first, when is the deadline to submit 2024 data for 2025 achievement awards? And as Liz mentioned before, the deadline is Friday, May 16th at 11:59 p.m. Eastern time. Again, something I think to bring back to the surface is if you've submitted data before, do you need to re-register? But no, you can log in using your current account and submit data as you did the prior year. So please only re-register if you are requesting new initiative access. And then lastly, where can you find more support on registration accounts and data submission? And you can do so at the link on your screen at bit.ly/AQ contact us. All right, and I think I'm passing you back to Liz. Thanks.
All right, thanks, Rebecca. I am now going to share some slides that do a quick walkthrough of what submitting data looks like in the platform. The first step to submitting data is logging in at aha.infosarioregistry.com/login. If it's been a while since you've logged in and you've forgotten your password, you can use the forgot password link. That'll be there for if you set up your challenge questions, or you can use the need help options. For accounts that have been deactivated over time due to too much time passing between logins, you can also contact your local AHA representative or use our Contact Us form for help. AHA staff are always happy to help you with any user account questions. Now that you're logged in, you'll see one of two different views. If you're submitting data for multiple locations or multiple facility IDs, you'll be given the option to select which location you would like to access first. I'll be using our AQ Demo 5 site, so I clicked on the first name listed, and in this view, you'll see both the name of each of your location sites as well as their facility ID number. This will bring you to the community page. If you're only submitting data for one location, this is the page that you would see first. On the top right of the community page, you will find our navigation tips, and that'll help you know where to go, kind of rehash some of what I'm sharing today. On the left, you can find our library, which has a number of the helpful resources that we'll be highlighting next. If you're looking for user guides, data worksheets, measure specifications, the library is going to be a great place to go and handy because it's right there when you're submitting data. Finally, you'll submit data using program forms. You can navigate there either by clicking the icon under Get Started or by clicking the link on the left navigation bar, and that is where we're going to navigate to next. So now you're going to be on the program forms page, and here you're going to see two sections. Under the edit form section at the bottom, you'll be able to see any forms that you have previously open, both from this year or prior years. Once you start your form for this year, you'll be able to find it here where it'll say 2024. Under Add Forms at the top, you'll see all the programs and initiatives you're currently registered for. So you'll click Add New next to the desired program or initiative. And this little demo is on Target BP, so I would click Add New next to that initiative. You'll then be prompted to enter a reporting year. So remember that 2025 awards are based on 24 data. So I would enter 2024 and hit submit to get started. This will bring you to the program form that you selected. At the top, you'll see that you can save or save and exit at any time. We recommend that you save frequently as you go, as the form does not save automatically. So keep that in mind. Save frequently, save often. And then each program form begins with detailed written instructions in the body text of the form. To the right, you'll see the tab section. You'll need to answer all questions on the Target BP program form to be eligible for any of our awards. So you'll want to make sure that you complete all answers on all three tabs. Scrolling down the form on that same tab, the first two questions for Target BP both require a yes for award eligibility. The first is asking that eligibility question I called out earlier. So it's asking if you at your organization diagnose and manage hypertension up to and including prescribing and managing those medications. The second question asks you to confirm that you are a designated representative and are attesting that the answers to the questions are accurate to the best of your knowledge. Question 3 asks for your total adult patient population. So remember that for question 3, you're going to want to save the query that you used on this question to further break down the number by race and ethnicity as well as by payer group. Questions 4 and 5 are the denominator and numerator questions that are based on the MIPS 236 measure. This will determine your blood pressure control rate and affect your award status. Be sure to enter whole numbers only, no commas on any of the questions. And then questions 8 and 9 in Target BP are those race and ethnicity breakdown and payer group breakdown. Remember that identical questions appear on the Check Change Control Cholesterol and Target Type 2 Diabetes program forms. So if you are participating in one of those programs, you can simply copy and paste the same answers. The second and third tab house our Target BP attestation questions that fall into the categories of measure accurately, act rapidly, partner with patients, SMBP, and equitable health outcomes. As Allison walked through, these are the questions that are going to affect our Silver, Silver Plus, and Gold Plus award eligibility, but they do need to be completed in order to be eligible for any award. And the third tab is also where we included that new quality improvement activities question that we've called out a couple of times now. And finally, once all answers have been completed, you'll want to return to the first tab, which is called Facility Information, and you'll click the Data Entry Complete checkbox. If you cannot click that box, it means that something is missing or there's an error. So I would then go through, review all your tabs to ensure that no fields are left unanswered. And once you're able to check the box, you know you're good to go, and you can just click Save and Exit to complete the form. Submitting data for Check Change Control Cholesterol and Target Type 2 Diabetes follows a very similar process. You'll return to Program Forms and then click Add New next to the desired program, and then follow the same steps to open the program form. I also wanted to highlight that Check Change Control Cholesterol has just 2 tabs of data to enter, while Target Type 2 Diabetes has 3 tabs of data to enter. So make sure that you complete the required fields on all 3 tabs. And this concludes our very quick walkthrough of data submission. Our next section is on resources and tips that will help to provide you with more support along the way when you actually go to submit your data. To begin, we have created a couple of new web pages to make the full process of registering, submitting data, and utilizing our benchmarking reports clearer and easier. You can visit heart.org/outpacecvd platform to walk through the steps and access all of the resources that we're going to be walking through in just a moment. So this page will include resources for Target BP, Check Change Control Cholesterol, and Target Type 2 Diabetes. You can also find a very similar webpage on targetbp.org called Data Platform Resources, and you'll be able to find this underneath the awards banner at the top. You can click through steps 1 through 5 to see our recommended resources for each step in the process, as well as at the bottom of the screen, there is a related resources section that covers all of our most popular resource items. Looking more closely at those resources themselves, we have several that are focused on the technical processes of submitting data. Our quick user guide is the first one I'll call out, so I'll put a little asterisk next to this one. It's a PDF that goes further into depth on the quick walkthrough that I provided, whereas the Navigating the Data Platform PDF and video are more evergreen and provide additional detail on setting up your site characteristics and utilizing various benchmarking reports to support your quality improvement efforts. So they're very hand in hand, cover some of the same information, but the user guide's more focused on this year's data, and the Navigating the Data Platform's more about setting up and utilizing all of the tools at your fingertips. Then every year, we also create new how to submit data videos that include a full walkthrough of answering each question along with common errors. So kind of like that screenshot walkthrough, except for we really take the time to delve into every single question. The full walkthroughs are around like 20 minutes, and then we'll have a quicker version as well. The 2025 demo videos are underway right now, and they should be available in February. But as most of the content is the same year over year, the technical aspects included in the available 2024 videos should still be helpful if this is your preferred learning method. We also have resources that are more heavily focused on the questions themselves that provide additional clarity and context. Our data collection worksheets are really the go-to for this. So this is what I would write out in all caps is so check out the data collection worksheets. They are absolutely my top recommended resource. We additionally have FAQ documents for each program and partnered initiative. I did see something in the Q&A. I haven't gotten to read them all yet, but I saw some questions about measure specifications, and I will just mention that in the data collection worksheets, at the very, well, like right underneath the instructions, we have what equivalent measures are listed out on the data collection worksheet. So the equivalent ECQM and if there are any other additional equivalent measures, they'll be listed on the data collection worksheet. For our attestation questions that really go into the weeds on clinical practices and that might overlap with quality improvement activities, we've created even more additional resources. So for Target BP, we have a full web page that is completely dedicated to the evidence-based BP pillar activities. And that includes a deep dive toolkit with resources, examples, and FAQs that are specifically about those pillar questions. And there's a very substantial segment on the measure accurately questions, which have been developed over time since we have had them in our questions for the longest amount of time. And then for target type 2 diabetes, we also have a clinical practice resource guide. We are still working on the 2025 version of that document. We anticipate some new resources that we want to include in that, but the 2024 version is available now, and like many of the previous resources, is still going to cover about 95% of the same content and topics. And then for organizations who plan to submit for multiple sites in the platform, we also have a tool called the self-service data uploader or the multi-site submission, just depending on who's talking about it. We kind of call it a couple of different things, but basically this is a tool that allows you to submit data using a CSV file upload rather than walking through the program forms. It is a helpful time-saving tool if you are submitting for more than 5 sites. If you're only submitting for 1 or 2, walking through the program forms is going to be a lot faster. But if you're looking at, 5, 10, 20 different sites that you're submitting data for, we really recommend going this route. And to gain access for this, you can reach out to your local AHA representative, or you can use the Contact Us form. There are templates that you can fill out, and we have additional instruction guides and demo videos to walk you through this process if it's something you're interested in. And it looks like we might end up with some time for questions and answers here at the end, and certainly happy to do that live on the call today. But I'd also really love to invite you to our data submission office hours in March and May. So these are really here to answer any additional live questions you might have for our national team. We go into a lot of the frequently asked questions, but if you're on your way and you're like halfway through submitting data and you're like, really love to ask that live, here is one of the opportunities to do so. And finally, I wanted to leave you with a few main tips and callbacks. So the first is to register new organizations early and to enter and save your data as early as possible to help with troubleshooting. We recommend using the data collection worksheets and the quick user guide as our main key resources. So that's what I was trying to asterisk earlier on the call. And finally, make sure that you can check the data entry complete checkbox before you save to ensure that your data is completed. Our American Heart Association team is here to help throughout the process, though. We can help confirm that your information was successfully completed. We can help to answer questions both about what is included on the program forms and those technical aspects. If you do not yet have a local AHA staff contact, please get in touch at that link on screen here, bit.ly/AQ contact us to be connected, and they will be able to provide you more resources and support along the way. And a final reminder that this webinar is being recorded and all slides will be available. We'll send all of those to our attendees once the webinar has been closed captioned and is available online. And I will just go ahead and hold this here. And I know we were directing questions to the Q&A, so might take a look there and see if Allison and Rebecca can help hop on and answer some of those with me.
Sure. We've been typing away with some written answers, but I think maybe we'll bring a few of those to the fore for everyone's benefit, so you can see those. I'll highlight a few from the blood pressure space, and maybe Rebecca, you could highlight a few others just for general awareness. The measure specifications for the controlling high blood pressure measure have not changed. So those exclusions and measure periods are the same. Another question that arose was that, that data comes from the calendar year 2024. And the same is true of your attestation questions. So the clinical activities that you implemented during 2024 are what should be reflected in those attestation questions. Some things may have been true before that, but and continue on into 2024. So that is also the case there. There is a question that came up a few different times, and maybe I'll ask you, Liz, to underscore the answer to this one. And it was about whether I can submit as one. Do I lump all my sites together? Can I split them apart individually? Are there other efficiencies in data submission? And maybe if you could just underscore that point again, I think that would be helpful. And I'll just finish by saying there are some questions about, where do I find more details about the evidence-based activities? And I think in the last few slides, you highlighted some of those great resources. So I'll stop there, maybe pass it to you, Liz, on that particular question, and then maybe Rebecca, you can highlight some of your similar cholesterol or other program questions.
Sure. So let's try and tackle that first one, which is it can be tricky and full of nuance, but we keep the definition of healthcare organization pretty broad because we know that the work that primary care and outpatient organizations is doing is very broad. So the way that you submit data as a system or as a single site is entirely up to you. So if you're practicing at one clinic address and you're like, this is our one location and we want to submit for that and get a certificate and award for that, that's the most straightforward. You're just, going to go through. But understanding that there are also health systems that might have 5 sites or 10 sites, each of those individual sites that want to be recognized would need to register online and would be eligible. If it's 5, if it's 10, each of those could be eligible for their own award and would just need to make sure that they're submitting data that is specific to that location. So you want to make sure for both the measure questions that you're looking at the patients that specific location is serving, but also for those evidence-based activities. Are you really implementing those activities during that calendar year at that specific location? And so that's kind of rolling up into that overall health system level. And you can do both those individual sites as well as a health system ID or setup. And The way you would go about registering it is just the same. It would be ABC Health System and then like ABC Health System dash Walnut Street or wherever you're located. But at that system level, you're still going to need to be sharing exactly the patient seen at the full health system. You're going to need to be able to give that measure data at the health system, and you're going to need to be able to answer those attestation activities at the health system level as well. So are you truly implementing these activities at all of the locations that roll up to that health system? And because this is a nuanced conversation, I really want to lean on our local AHA representatives who can help talk with you about what's right for your organization, what level of detail are you able to pull from your reports, and what kind of recognition are you looking to give and to celebrate, and how to celebrate your staff, and also what kind of quality improvement activities are you hoping to accomplish by looking at that specific granular data at the multiple locations. And I know that was that was a long answer. I think there was a second question you had, Allison. I'm trying to remember back, but I hope that's helpful, and I can certainly pass it over to Rebecca to tackle some cholesterol questions.
Yeah, before I move to cholesterol, most of it was really just measure equivalencies, but I like that you landed on the local AHA staff, because the question that just came in, is asking that, they're new to this program. Will they have someone to assist them getting registered to help with activities? And then what's the criteria for registration as well? I know you just touched a little bit on that local relationship, but I wonder if you can you go into a little bit more detail and what they can assist them with.
Sure. So when I'll kind of start with the registration. So again, you can just register online, and we're going to be looking at basic demographic details at a much higher level than the demographic details that are in the program form. So when you go to register, we will ask a little bit about your race and ethnicity breakdown, but it is not nearly as granular as the UDS table that we ask for in the a breakdown similar in the program form. When you go to register, if you're registering for multiple sites, like I mentioned, embedded in that primary form is a link to an adjusted form that allows you to register for multiple sites at one time. Again, I think it's most helpful if you have more than 5. Otherwise, it's just easier to go about it the main way. But when you're doing this, I know many of our staff will set up a quick call to walk you through the process or give you a demo, or they are constantly coming up with new creative ways to be there and supportive. Some of our staff have the ability to, schedule a meetup time and be there in person if you wanted to do that. And some have to, are more inclined to, hold a phone call and do screen shares. And sometimes that's easier because they can kind of show you and walk you through the registration process. But it is it's just an online form. So there's no, that's how we'll get your account set up. And that is kind of where we get, our data use agreements are embedded in the registration form. And that's why we encourage you to register for whichever organizations you have kind of an inclination for getting started with.
Great. Thank you, Liz. And I think it's important to note too that our local staff can help to support you throughout the process. Unfortunately, there's no way for our local staff to submit the data on your behalf for you. So I think that's an important note to make as well. So the questions I think that were regarding both cholesterol and diabetes were really, again, relating to the measure equivalency. So asking if, MIP 438 is the same as CMS 347. And I want to draw you back to the program. Liz, what is the actual name of it? The data collection worksheets. And that is where it has it on the exact top. So
yes.
Thank you. So it has all of the measure equivalencies on that, for which Fatima dropped a link in the chat as well. So highly recommend taking a look at that and downloading that to make sure that you know all of the measure equivalencies. But I do actually want to turn it back to you again, Liz, just for guidance here. So one of our attendees asked, what's the guidance again for patients that visit multiple locations? Do you count them for each location and then just once for overall values?
So I trying to sort through the nuance of this question, but I think generally speaking, it's important to keep in mind that we're looking for aggregate information here. So if you're looking at, like if you're submitting for multiple locations, we understand that somebody might be seen in one and then at another. We're not looking for that patient level detail. We're really looking for that aggregate detail of the healthcare site and location. So I wouldn't worry too much about, trying to make sure that a patient isn't double counted from multiple locations because that's not really truly representing their experience. Their experience is at each of those locations, and that's what we're trying to represent. When it comes to like the patient visits and how that rolls up into the measures, I would encourage you to look at the specific measure specifications, which can give additional guidance on like how to choose which blood pressure reading to use when calculating the measure performance. Allison, I'm not sure if there's anything else you would want to add to kind of that denominator numerator detail, but I'm when
No,
in doubt, back to the
no,
measure.
no, I appreciate that, Liz. And I think the only one, we're trying to avoid duplication and sort of not double counting individuals. And I think your guidance around looking at the measure specifications and, attributing the patient to the place where the measures that were used in the calculation and attributing that way probably makes the most sense. But we can certainly explore that more
Oh,
offline.
and one thing I didn't call out during all of this, but the measure specifications, they are linked in the data collection worksheet. They are linked in the FAQs. They're linked in the platform and in the library. So we really are trying to drive back to that. I didn't do like a slide on the measure specifications themselves, but we do try and refer back and make that as easy as possible for you to get to.
One other question I'll just underscore that came up a few different ways is individuals recognizing that the person who submitted last year is no longer with our organization, but we have an account and we want, do we need to start over? And just to underscore that you can reach out and we'll drop that link in the chat again to have additional users added on to give access to your existing account. And similarly, you just may want more collaborators and you may want more people or different people to have access to that information. So rather than go through that registration process again, or we don't want to create duplicate accounts, it also will give you access to your historical data. And I know Liz has shared that in previous webinars, the beauty of looking at your performance over time, comparing to your peers, and just, the more years you contribute to that same space, the richer the information becomes.
Yeah, I'd love to underscore that setting up your site characteristics is a great kind of first step in getting comfortable with the platform. And also, just to reiterate, there is not like a maximum. You're not like only allowed 2 users. You can have as many users as makes sense for your organization, whether or not like you're splitting up. We do see quite a few organizations who have a couple of data analysts who are responsible for actually getting the data into the platform. And then they have their QI representative who is in there utilizing the benchmarking reports or working with our local AHA staff to identify different opportunities to follow up on. And this being a data submission webinar, we haven't really focused as much on those quality improvement activities, but it's certainly something that our staff are eager to help support you with as well. right. Did we have any other questions, or were we able to get through these?
You guys were terrific bringing your questions forward. The only other one you may have said this while I was typing an answer, so I apologize if I missed the answer, but just to underscore, a lot of times our answer is reach out to your local community impact HA staff because they are experts in this process, terrific navigators. If you don't know who that person is in your area, Liz, can you recommend the best way for folks to find that out? Or maybe you've lost touch and just need to be reconnected.
No, absolutely. Thank you. I think that was like in my tag to make sure to say before we hopped off. So I'm glad you called it out. Yes, we are happy to connect you with your local team. It's going to be through this bit.ly/AQ contact us form. We have staff across the country who are helping to monitor that form. So they're going to know who the best person is to connect you with locally to get started, or to just bring more depth to your work together. All right.
I think the only thing I'll just add on, Liz, before we wrap up, is to encourage you. Today is a moment where you might feel overwhelmed with the details and the click here and enter this and review that. There's a lot of wonderful resources. I will say that it's worth it. I mean, organizations who engage in data submission are really grateful to be able to celebrate the work of their team, their institution, celebrate that within their community. And the one thing that we're seeing in the data, and we have the vantage point of looking across, all the initiatives and all of the data submitters, that organizations who get involved and stay involved keep improving. And that's really become increasingly clear in the many years, 7 or more years that we've been doing this. And so I really encourage you to find the time and the will to participate, because I think it is well worth your effort. So I'll turn that back to you, Liz or Rebecca, for any other comments.
Yeah, I think my last comment is just to build on that. We're always excited to see organizations improving and their measure specifications, but also I'm going to just thank you as organizations submitting, because you give us information to improve our programs and initiatives as well. So many of the changes that you see year over year are us listening to what you're sharing through your data submission, and finding new ways that our teams can help add additional resources and support in those areas. So just adding on an additional thank you for participating in our initiatives and submitting your data and joining early in the data submission cycle. So it's get off to a good kickstart.
Yes, thank you all very much. I apologize. I'm monitoring the Q&A for any last minute straggler questions that are coming in, but appreciate everybody's time, and so excited to be able to celebrate the amazing achievement in all of your organizations.
Right. Thank you all, and we're going to end the recording here, but if we see any additional Q&As, we'll follow up with you after the webinar. Have a great rest of your day.
Thank you.